Welcome to the Littleton Board of Health Wednesday, March 17th, 2021 virtual Zoom meeting. I'll just read the Zoom rules. The town of Littleton began conducting remote participation / Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th, 2020. Since that time, unanticipated legal concerns related to the open meeting law have been brought to our attention by the town clerk. These concerns are supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to the board's public meeting. Chat is essentially running commentary that is occurring, but is not moderated or followed by the chair. All participants and listeners may not be aware of comments being made because some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents within the chat room, which are not incorporated in the public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussions and sharing information during the public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you call in by phone, please use *6 to mute or unmute your phone so that the meeting can occur in an orderly fashion. We ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom. And if you call in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute and state their names and addresses. And after speaking, we request that participant return their microphone back to mute. So you guys saw the agenda. Are you all set for time, Jim?
Yes, I am.
Okay. So do you guys want to start with the discussion rescinding the motion requiring pool testing for extracurricular activities and sports? Kevin, does Kevin need to rescind that, or can I do that? What do you guys think?
I think just make a motion and second.
Oh, go ahead, Kevin.
I was just wondering if you wanted to rescind it or reword it so it states recommend instead of require.
I think, Kevin, we need to rescind it because we need to let school committee have a chance. We need to discuss it a little bit more, and school committee needs to discuss it, and then we'll meet with them next Wednesday after they've discussed it at their meeting this Thursday. So why don't we rescind it, the motion, and we can at least discuss it, what we think, and ask Jim what he thinks, and then there's some DESE concerns. So.
Well, I'll make a motion to rescind the motion requiring pool testing for extracurricular activities and sports.
I second.
Okay, and the roll call will do Kevin Baker.
Kevin Baker, yes.
Gino.
Gino, yes.
Louise, can you vote?
Louise Nichols, yes.
And Mike Zeldin.
Mike Zeldin, yes.
Okay, and Lisa Flanagan, yes. So if you guys want to, let's discuss it a little bit more, or do you want to wait and hear what they talk about at school committee?
Yeah, let's wait until see what happens.
Did anybody want to discuss it?
I think we should discuss it.
Okay. Anybody else want to discuss it?
I think if Louise wants to discuss it, we should.
Yep, okay.
Let her discuss it.
All right. Jim, do you have any input in this at all?
So again, some of the things we've seen during contact tracing, I think I certainly could support a recommendation that the kids who play sports are included in the pool testing if they're not otherwise being included in the pool testing at school. Some of the things we've noted, and this is all anecdotal, is that we've had situations where somebody plays a sport and then, maybe at the end of the day, they're symptomatic. So, kids being the nature of the way they are, they may be fine during the day, play 2 or 3 games, and all of a sudden they crash at night, and maybe it was just the end of the day they noticed they were sick. So sometimes miss those things. Other things we've noted is that kids don't just play on one team anymore. We found this particularly with hockey. They could be involved with the school team and a couple of club teams, and all of a sudden they're pool of people they're exposed to gets bigger and bigger. And then we've also, you still have the issue with people, the transportation to games, and our concern sometimes with how people are handled. And I don't mean that the way it sounds. How people are what they're doing just before and just after games. So the state guidance recommends this arrive, play, and leave kind of process. I'm not sure how much of that happens, whether people are, whether you've got teams that are kind of, one team's coming off the field and another one's coming on, or whether people are staying after the game or coming before the game. And so there are those situations where people can get together that make us a little bit more concerned about the kind of all the mixing of people.
So that it sounds to me, Jim, like you're giving all the rationale for why testing should not only continue, but to recruit more, shall we say, participants, because it is a surveillance system. It's not we're trying to detect everybody. I mean, if everybody joined in, that would be fantastic.
And I think, I would imagine even the team captains or the coaches and that would want to do that too. I mean, you'd really like not to have, in hockey, they take kind of the most severe approach to contact tracing. So in hockey, anybody on the ice, including the coach of the team where the person's tested positive, they all are quarantined if somebody tests positive on the team. So other sports, you take a different approach to the contact tracing, but hockey has been, I don't want to say more problematic, but maybe seen more cases because of hockey. So if you want to try to maintain the smallest amount of detriment to your team due to a person who tests positive, maybe you really want to think about pool testing so that you find out that person shouldn't be there beforehand. Like I said, the nature of kids, we've heard, the nurses have heard parents saying, geez, he's fine earlier in the day, or she was fine earlier in the day, and then the next morning they woke up sick. So again, I think probably the nature of kids where they're generally very healthy till they're not. And then all of a sudden, maybe you have an issue. Again, I certainly could support that recommendation for being part of the pool testing.
Right. I think there's a difference between the pool testing is voluntary too, not mandatory.
Okay.
So I have my thought is just the jeopardizing of the health of many people for the athletes that play. So, but I can also sympathize with the fact that the numbers are low in school, and the testing has been showing that there's not too many positives in the school right now. So
I believe the testing in schools is still limited, if I'm not mistaken. Someone should correct me, to the elementary school folks, or is it? So we don't know really what's going on at the high school level.
right. Yeah.
Middle school, where they do play hockey. Okay.
Right. Yeah.
In fact, they are the little midgets that also play, whatever they're now called, that play, small time hockey.
The little ones. Yeah.
Yeah, the Munchkins, right? Munchkin hockey, right?
The Mike, the squirts, the peewees.
Yep.
Yeah. All right. Kevin, did you have anything that you wanted to discuss at all? No. Louise or Gino?
Yeah,
No.
I have some, I think the wording before, we made it sound more mandatory than, I think it should be more of a, like we said, a recommendation that we're suggesting that they do it, not forcing them to do it.
Yes, suggesting that's the right word. Yes.
That's what I had a problem with the wording before.
And parents I just want to say that this is all wonderful, but keep in mind the parents still have to sign consent in order for any of the children who are considered minors to be tested.
Mhm.
So parents control a lot more of, shall we say, this pool testing than we may fully appreciate. So that's why I'd like to give the school committee, I think the school committee is all in on testing. I think if it was up to them at this point, they probably would be prepared to test everybody if they could. All right. In other words, enough with the surveillance gives enough, there's enough testing equipment and materials around now. They could probably get close to maybe 80% of a population to test. How routinely, I don't know. So it seems to me I'd like to give them as much help as possible. So in addition to discussing making requirements for pool testing, whether it's for athletes, teachers, or anybody else, I think it would be very helpful if we could come up with, help them come up with an approach that would be, as it were, more induce more or persuade more parents, therefore more participants to come in, because there is a small, I don't know how large a group of parents who, for any number of reasons, and I'm not quarreling with what, because I don't know them, I don't know the reasons, for any number of reasons, are not terribly happy about having their kids tested.
But there's nothing to it, Mike. They only put the thing on your head. That's it. Very simple. They see if you have a fever or something like that. That kind of testing, I think we're supposed to suggest.
No.
Not putting something in your nose.
No, Gino, no, that's meaningless. That test
All right.
went out the door years ago, months ago. We're talking about getting a biological sample, however obtained. All right.
I don't think that's it. The parents were like that. But anyway.
Well, it's our job to encourage them, Gino,
Yes,
to
I agree.
take it.
I agree, Michael. I agree.
Okay, so maybe we can watch the school committee meeting tomorrow. I think it's on their agenda, and then we can discuss a little bit more with them next week at our meeting.
Okay.
Does that sound all right, everybody?
That sounds good.
Okay. So we'll go with the COVID update.
Okay.
Jim?
Sure. So, probably the biggest news today was the governor kind of laid out the timeline for everybody to get vaccinated. And again, the new pre-screening system that they have for people to sign up. I went on and got, signed up for a pre-screening, and it is pretty straightforward. It is pretty simple. And then you end up with a code that you can punch in once they notify you of an available appointment. So it seems pretty straightforward. And on a call today, our district's call today, it seems like the new software is working okay. The state seems to be happy with the new software. So hopefully they will expand it to, right now the new software covers, if you sign up for the pre-screening, you're signing up for essentially an appointment at one of the 7 mass sites. So it doesn't cover all the sites in the state. They're hoping that if the software continues to perform well, that they'll expand it to the other sites, so it'll cover more sites. Hopefully that'll happen. With more and more people being vaccinated, the state has changed some of the orders. So the travel order now takes into account that people are vaccinated. So if you're fully vaccinated and have been for at least 14 days, you don't need to do testing or quarantine on travel. So that's been added to the travel page. And the same thing for people who are close contacts to somebody who's testing positive, as long as they're fully vaccinated, and it's been 14 days since that, they don't need to quarantine. I just want to correct one statement on the travel order. The travel order distinguishes if you're fully vaccinated but have symptoms, and occasionally we've heard of cases where people have gotten the disease even if they're vaccinated. If you're fully vaccinated but have symptoms, you do need to follow the travel order's requirement for testing and quarantine. So that's just a little bit of difference on that. The governor, the last time that they kind of changed things, they mentioned that maybe on March 22nd, we might go to phase 4, step 1. I would expect if that's going to happen, we'll hear about it either on Friday or the Monday press conference. I'll know a little bit at the public health meeting in the morning. I'm not sure. Again, we often only get about an hour's advance notice of what the governor's going to say. So, and that's a change from the beginning of all of this. So the public health metrics, and that's what it was predicated on when they stated back then that they may roll it back to, or may allow us to go forward to phase 4, was based on the public health metrics. So right now they're stable or slightly increasing the number of cases a day. So I'm not sure what, the hospitalizations I believe are still down. but the cases are up a little bit, the 7-day average. So I'm not sure what they'll use and whether we'll still be going forward on Monday. We'll have to wait and see. More locally, the cases are, as we're seeing in the district, they're either stable in the towns or going up slightly. And that's the same thing with the state. They seem to be going up slightly. Littleton had a little bit of an increase based on the numbers I was able to pull this morning over the past couple of weeks. As far as vaccine administration, according to the vaccine report on the state website, about 3.1 million doses have been delivered to the state. We've administered about 2.7 million doses. And they said about 972,000 people are fully vaccinated. So that's not a bad situation to be in. And it was interesting to hear that there was a surprising increase in the number of doses the state got. So I don't know why that was a surprise to somebody, but it seemed to be a surprise. So hopefully we continue to get those surprises over the next few weeks. And I think in the press conference today, I was reading the press release part of it. One of the reasons he decided to open up the different phases, or at least delineate the upcoming phases, was that in their conversations with the federal government, they felt that there was going to be an increase in vaccine supply to the state. So all good things in that regard. So, and that's what I have for a report. So
That's a very good report. I like that. What, Jim?
I was responsible for it, Gina.
Where are those 7 places that you mentioned? Where they're located?
So there's one at Gillette. Gillette is one of them. Fenway, or actually now it's the Heinz Convention Center, I think. There's a site in Danvers. There's a site in Springfield, and I'm not sure where. I think there's a site in Worcester. I'm not sure. They're on the state website on the vaccination page there.
Okay, I'll look into it. Yeah.
Yep.
Thank you so much.
You're welcome.
You did a good job. You always do.
Thanks.
You're welcome.
What
Right,
are
Mike?
What are the CVS sites? Who are those open to? Is it just teachers, or is that you contact CVS's site to get a vaccine from them?
I think some of them are listed on the state's vaccine website, but some of them some of the CVS's, and I'm not sure if it's all of them or just some of them, seem to be part of a federal program that allows them to get vaccines. So if you look at the state's vaccine report, they have a carve out for federally supplied or supplied vaccine. And it's about 100,000 doses this past week. So and it was interesting because early on, some of the CVS's, like even before the teachers were eligible, according to the governor, some of the teachers were already getting vaccinated at CVS's. And I think because they follow the federal rules, because they're getting their vaccine from the feds, I think they were able to do that. So I don't know how that is distributed, how you become a federally supplied store versus maybe something that's getting the vaccine through the state. But there does seem to be that. And early on, even the VA was slightly different. There were people who were getting shots at the VA.
Oh, yeah, veterans. Yeah.
So there's different pools of vaccine depending on where you're getting your vaccine from.
That's nice.
And did we ever use AstraZeneca in the States, or is that just in Europe?
I don't believe it's been approved in the state.
Not approved here.
Not approved. All right. Great. Did anybody else have any questions for Jim?
So
Jim, just one quick distinguishing feature. What's the difference between a regional collaborative, which, by the way, has access to about 40,000 doses, as opposed to a local boards of health, which has a mere 19, I mean, this is one of the things I got, 19,000 doses. What's the difference between a regional collaborative and a local board of health?
So part of the local board of health could be those, like the clinics that we were running were local. We can't run them anymore, but I'm not sure if they're still counting. Like we have one more second dose clinic next Thursday to try to finish up the ones we started.
Right.
And there are some municipalities, because they're the 20 that are disadvantaged communities that have had a higher burden from COVID. So there are 20 communities. I'm not sure if they're including those in that local board of health, because those are cities and towns, and they're pretty good sized cities and towns, and they're getting vaccine directly from the state. Then the regional collaboratives are just that. There are, I mean, it can be, I don't know, There's one on the Cape, and there's a bunch of the communities. I'm not sure if it's the whole Cape.
Yeah.
Up in the North Shore, there's a group of them. Down southern Worcester County, there's a group of, I think, about 10 boards of health that got together to put together. And so the state has recognized those as regional collaboratives. Those where the 20 communities can dedicate their vaccine to their citizens, the regional collaboratives really need to open up their clinics to statewide appointments. So there's a little bit of nuance there. The regional collaboratives are allowed to use a little bit of their vaccine locally, but the majority of it has to be distributed statewide.
Right.
And the regional collaboratives have to be open. They have to have the capacity of being open 5 days a week and the capacity of administering up to 750 doses a day.
Wow.
Yeah, I did know that there must be a surge in production and distribution of vaccine, because I noticed that the mass vaccination locations received pretty close to 102,000 doses. Now I realize they're doing second rounds.
Yep.
Right. So a lot of them are. And health systems and healthcare providers, including, now this one's a new one to me, CHCs received almost 100,000 doses as well.
Wow.
So health systems and healthcare providers, excluding CHCs. The reason I'm asking this is because the picture from all this, and this is good for us to know, just shows you how fragmented our healthcare system is in Massachusetts. For a little place like Massachusetts, how, shall we say, a spot here, a patch here, a box here, a castle there. I mean, it's no wonder when the feds look at this, they wonder who they're dealing with.
With a midget.
All right, anybody else have any questions for Jim?
Thank you, Jim.
Thanks,
Yeah,
Jim.
thanks, Jim.
Glad you signed up, Jim.
Yeah,
Now we'll know if it really works.
Like I said, it was pretty slick to do. I just wanted to, if I had to describe it to someone, I want to be able to describe it. So.
Oh, good. Well, I hope you get to go out to Gillette Stadium, because after your second dose, you get to go down in the field and play catch with an otherwise unnamed, recently signed Patriot.
Nice. Well, I figure I'll wait till there's something more local. I'm a little further down the deadline for getting a vaccine. So.
Okay.
I'm sorry that you didn't get one of your own clinics, Jim.
I figured there are other people who need it more than I do, and
Yes.
I live a lifestyle that I can generally stay far enough away from people. So I figured I was safe enough.
He stays on his yacht on weekends. That explains the whole thing. Thanks, Jim.
Yep.
Thanks, Jim. Hi, Katrina. Are you all set? You ready?
I'm here. Like Jim, I had to test it first before I described it to people. So I'm also pre-registered, which is nice. All right, so here we go. Let's see, rearranged everything. So let me get you guys back. I swear my computer has a life of its own these days. All right, just dive in. So we're to the state data. Here are the trend lines from the beginning of the, since a year ago. Things clearly look good, but we still haven't returned down to early fall levels. We're still at like November levels of cases and even test positivity. And our hospitalizations have come down and our deaths have come down, but let's zoom in a little bit and look at these trends closer.
Beautiful. Look at that. Turned out with babies. Wow, nice.
So these are the testing levels for the last 6 weeks. So from the end of January through current, the testing levels for molecular or PCR tests have been pretty stable. And also antigen tests have been pretty stable. So across the board, the number of people who are receiving tests hasn't changed dramatically. This is important because a lot of states other than Massachusetts have actually had declines in the amount of testing happening. So we have maintained our testing levels throughout this last few months. So these are the test positivity for the last 6 weeks. So test positivity, again, just to remind everyone, is the number of positive tests divided by the number of tests conducted. It's not number of people. So the test positivity this week is about 1.84%, and last week was 1.76%. So a slight minimal increase. So really my role would say it's about the same. We're still flat. The governor did emphasize in his press conference today that about the importance of testing as one of our layers of mitigation and helping to slow the spread. So I think so much focus has been on vaccination. He's worried that people are forgetting the importance of getting tested if you have an exposure or if you have symptoms. So he wants to keep that up. So this is a big part of our toolkit, is to continue testing. These are the number of cases over the last 6-week period. Like last week, we're essentially the same level. The 14-day statewide incidence rate was 19.5 per 100,000, and last week it was about 20. So we're relatively the same. As Jim mentioned, when you look at a 7-day rolling average, we're actually slightly higher. So this smoothed it out, but next week we're probably going to see a bump. The other thing I've noticed is that these bottom part, this probable case area, is about, or for people who, a probable case is one person that either has a positive antigen test, has symptoms and a known exposure to someone who's COVID positive, or died and the death certificate says that the COVID was the cause of death. So while these numbers are small, they're still just over 200. They actually ticked up a little bit last week. So these don't get moved into confirmed until there's a PCR test or like there's more to it. So eventually they might get confirmed, but at this point we have a little uptick on the rapid antigen tests. However, in terms of all the cases, it's not really going to move the mark. So don't worry about that quite yet, just knowing that they're there. Hospitalizations continue to decline. The 7-day average continues to like slowly go down. We're still at the same level, like I said last week, which is where we were mid-November. It's about 660 hospitalizations per day. And hospital and ICU capacity has been the same level for weeks now. It's about 85% hospital beds are occupied and 74% of ICU beds are occupied. And then the number of deaths has stabilized as well. The 7-day average is about 31 deaths per day, which is the same number as we were just about at Thanksgiving. So that has not declined further. It's kind of holding steady. So hopefully that will keep ticking down, but it's just not dropping the way that you would hope to see. And again, like with the fewer cases that are circulating, these two indicators are lagging indicators. So we would hope that if cases aren't dramatically rising, the hospitalizations will continue to go down slowly at this point because we're stabilizing our cases and the deaths as well. But again, everything, you can even see hospitalizations and deaths, we've slowed down. We're not in that decline that we were in even 2 weeks ago for these two metrics. So this is the snapshot of the immunization, the vaccination report. This report, I'm only looking at the weekly one, which is the one from last Thursday. Jim has a much more updated number, what he just reported. So I will look at the next one tomorrow, unfortunately. So as of last week, we had just nearly 800,000 individuals who are fully vaccinated. That was about 11%. What Jim just reported today means, if my calculation is correct, we have about 14% fully vaccinated, so an increase of 3% of people in our state. And about 22% as of last week had received at least one dose. So in Middlesex County had about 11% fully vaccinated and 21% at least one dose, so similar to the state. So we're looking at Littleton. Just a reminder, we're in the under 10,000 group. So this is from the weekly DPH report from last Thursday. Last week, Jim's Maven sneak peek was right on. We had 17 cases. And compared to 2 weeks prior to that, we had 20 cases. So a slight decline. We're still in the yellow. So really these, I think what we're going to see is these 17 to 20s, if we're lucky, are just going to be stable, and we're going to see them bounce between those for a while. But if week over week you start seeing a direction in one or the other, we'll know what's happening. So if we look at the trend lines, this is the rate per 100,000 people. Last week, Littleton's rate was 12.4 per 100,000. And that was similar to the week before that and similar to the week before that. So we have flattened. So you want week over week a trend will tell you which direction. We're at a flat spot right now. And similarly, all the other areas that we've been tracking from the beginning of this, or beginning of my time with you, have also similarly slowed and flattened. And this is test positivity for all of the areas we track. Littleton's test positivity last week was 1.46%, which was similar to the week before that. And like our rate here, everything, and not only in Littleton, but every area that we track, everything kind of flattened out. So this is, again, a 2-week average, not a 1-week average. So this is Jim's sneak peek. And he gets in the Maven database and says that at this point in time that I'm actually accessing the data, how many cases does Littleton have? And Jim reported 21 cases this morning. So that is compared to 2 weeks ago, we had 17 and now we have 21. So that's a slight uptick. However, still in the yellow. And like I said, that 17 to 20 number, we hopefully will oscillate around. Ideally, we'd go down, but I think given where we are and the number of people vaccinated, things like that, it would be hard to get back in the green. But so at this point, I would say we're still holding steady with an inkling that we should keep an eye out. And then my reason I think we should keep an eye out is when you look at a 7-day case, new cases over a 7-day period. Last week's report indicated we actually had a little bump up. So you see the whole thing from March to now. We went down 2 weeks ago. We had our lowest number, and then we had a slight bump up. And if my math is correct, we might have another bump up, or hopefully we'll hold right here. So we will see where this goes. But again, when you do 2-week averages, you kind of smooth the trend. It helps you understand where it eliminates the noise, but it also can hide how quickly you react to it. So just keep in mind that remember last week I was like, there's an inflection point happening. We don't know where we're going. This is a little hint that we maybe don't want to go in this direction. Let's see where we are in a couple of weeks, but everyone should be careful. So the other hint that our local trends might be going back up is the school's health notification reports. And this is actually probably the earliest signal we get that things might have changed. So last week we had 2 cases reported in the schools. They did not come through pooled testing. They actually came through the symptomatic close contact testing, as we traditionally have seen throughout this whole year. And the week before that, we had 1 case. So again, 2 indicators that something is happening. Again, they've kind of oscillated between 1 and at the worst, it was 5. But they've kind of hit 1 or 2 every couple of weeks. And that's kind of like their baseline. Like it's like that oscillating between 17 and 20, right? We'll see if this keeps going up or if it just holds steady. However, the good news is that there had been, as of last week, there had been 8 days of pooled testing, and all 8 days had 0 cases across all the pools. So that was a lovely hint that, these cases that we see on the health notification didn't actually enter the building and get caught in that system. So, there was a close contact. So they were in the building, but it doesn't look like at this point if there's any cases. And we'll see this week's, I haven't heard about this week's pooled testing to see what happens. So hopefully, I know Lynn Snow's really keeping an eye on that. And she and I've had just a brainstorming conversation of things to look at. So I think she's really trying hard to keep an eye on all these things. So the schools in total have had 41 cases to date, which I still say is amazing given everything. And then hopefully and they've been scattered across the 4 schools. No one school has been hit harder. I would say that when I say they're scattered across the 4 schools, Littleton High School has fewer cases, but I also hear there are fewer in-person learners there, whereas the other schools have more in-person learners. So they're actually pretty equal in cases. So it's still, I think, pretty evenly spread given the denominators in those schools. Okay, so backing up a little bit, getting a wider view of things. So this week, the CDC and the Health and Human Services updated how they classify variants. So they're now putting them in categories of variants of interest, variants of concern, and variants of high consequence. So the variants we've been talking about week over week actually have been classified as variants of concern. These are variants that have evidence of increased transmissibility, more severe disease, significant reduction in like how vaccines work or antibodies work for natural infection or treatments. These are things that may lead to treatment failure, vaccination failure, things like that. So these are ones that are being tracked because they might require public health actions. So this week I heard a news report that in addition to the UK variant and the South African variant circulating in Massachusetts, we now have a Brazil P1 variant circulating case that appeared in our state. So we've added a yellow line of data. The other thing that's to keep a note is the UK variant has been estimated to be about 25% of the US population. And that was up from 2 weeks ago. I think it was 10%, or maybe it was a week ago. I can't remember my timeframes anymore, but it has increased. It's doubled in a relatively short period of time. And it's not uniformly spread across the United States. Florida and California clearly have a higher burden than other states, but Littleton, I don't know about Littleton, Massachusetts definitely has the UK variant. And the last check I'd seen for BU was last week, and they were saying 25% too. So in their small sample. So I don't know where we are as a state, but it's here. And the reason it's concerning is that it's about 50% increased transmissibility. And then I saw the 5th study that came out about it, and saying that it is higher severe disease, so more hospitalization, more severe outcomes for patients, more death. So it is a concern. It's here and it's spreading, and it's one that not only is it a variant of concern, it's one that's here and we should be concerned about. So just keeping in mind, everything we can do to slow the spread will help prevent all 3 of these actually from spreading. So let's talk the cheese. So the cheese is what we use to slow the spread, right? This is the time we are in a race against the variants to get vaccinations in arms. So everything we can do right now to slow the spread of these variants, whether you're vaccinated or not, is really important. So I want to just dig in. We know the layers of cheese. We've talked about the layers of cheese. We keep trying to help with schools and businesses and everything locally to help slow the spread. So at this point, I really kind of want to focus on some of those individual behaviors. So one of the main things you can do, one of the easiest things you can do, is to look at the quality and fit of your mask. We've talked about this week over week. I'm going to keep saying it. So one of the things that was shown to be really effective was making sure that your mask fit well, fit to your face, and you weren't getting air escaping through the sides of it. So making sure there's no gaps, making sure it's over your nose and your mouth, and that it's a good quality multi-layer mask is better than a single layer mask. So here is some ways to check about the quality of your mask. And I think as we talk about adding, I know as a parent, as we talk about adding more people into the school buildings, that's a high density area with people who aren't vaccinated. We've largely not been sick because we haven't had a big cluster form in our schools. That this might be a really great time to look at your kid's mask and say, can I improve this somehow? Can they double mask? Can we add a filter? Can we just make sure it's a 3-layer mask versus a single layer mask? Things like that. So as a parent, I am checking my kids' masks before they start in-person learning with more people. As Jim went over today, the vaccines continue to roll out, which is awesome. And the phases were actually given dates today for eligibility. I think this made a lot of people happy to know that there's actually a date that we're looking at, and it's not that far away. So I really do hope that the federal government supply keeps up with these plans. This would be great. So the governor keeps saying there's more capacity in the system for more vaccinations than the vaccines that they get. So let's hope that this is true and we'll see this roll out smoothly. As Jim said, it's really easy to register, pre-register. It took us, I think, a minute each to do it in our family. And so I encourage everyone to get on the state's pre-registration, do the pre-registration process and just get that in. So that also probably helps them see where people are who want to be vaccinated. So as they start looking at sites, maybe they could add some near us. So the more people in our area who pre-register, that kind of shifts people with the focus of where they need to get a site. So that would, I think, be useful for planning. I'm sure they're already planned, but hopefully. All right, so last week we went over the CDC's, what you can do once you're vaccinated. There's a lot of hope and there's a lot of great things to look forward to as we all get vaccinated and complete that process. The more and more people who get vaccinated, the more open we can be about things, more relaxed. All those layer of cheeses, we kind of jiggle around which ones are more important. So vaccines, a very important layer of cheese. But given that, 11 to 14% of our state has been fully vaccinated, there's still a lot of us to go. And so it's really, like I said, we're in a race with the variants and vaccine rollout. So it's really important right now that people don't just throw the towel in and say, we're done and I'm going to start doing everything. So it's really important that before, between, and after being vaccinated, you're still wearing your mask, washing your hands, keeping your distance, avoiding groups, doing all those layers of cheese that we've talked about over and over. Let's just slow the spread. The fewer cases, the more vaccine rolling out, the better we're going to be as a community and a state. And then we've got some holidays coming up, and so you've got Easter and Passover, and these are gathering holidays. These are times where people come together to celebrate and be together as families or groups of people, places of worship, things like that. So the good news is that unlike Thanksgiving and Christmas and the December holidays, many of us have some family members who have been vaccinated already, and that fully vaccinated by now, which is kind of a relief. It kind of gives us some freedom to maybe see them this holiday season. But there, again, like I've said, there remains many of us who have not been vaccinated and some who are at high risk and have not had a chance to be vaccinated yet. So doing what we can to limit transmission of COVID is important. And this is a holiday where I'd hope people can think through how they're going to celebrate to minimize risk. So it's still wise to take the precautions during these upcoming holidays and have a discussion with all your guests about what you're going to do and how you're going to do with it, especially if some people are vaccinated and some aren't, like how you're going to put it together. Remember, the CDC recommendations is that with a vaccinated person, you have one other household that's unvaccinated. So probably not the time for an extended family gathering with multiple unvaccinated households together, but go see your parents, or if you do get together with multiple unvaccinated households, let's talk about those layers of cheese again. So those remain like masks and distancing and improving your ventilation by meeting or eating outside and opening your windows and doors. It's better weather, so it should be easier to do those things. Get tested before you're gathering. Follow the travel order. Make sure you're looking at gathering limits. Those are still in place even with vaccinated people. So the more layers of cheese you use, the less likely there'll be a transmission event at this point. And the last thing anything wants, like after Thanksgiving and Christmas, there were so many reports of families gathering and then some older member of the family getting sick and having some severe outcomes, including death. And what you don't want, we're almost there. We're almost at the finish line. We're almost going to get our vaccine. So don't stumble right now, before the finish line here. So also, if you're going to a place of worship, just make sure you're practicing safe gathering, the masks, the trying to keep your family distant from other families. If there's a virtual service, that would be a great thing to do right now if you're unvaccinated. So, and important of all of this, if you're sick, you have symptoms, or anyone in your household has symptoms, or if you've had a known exposure to COVID. So please just stay home at that point. So we're almost there. Don't give up now. So this is just yet another holiday. We've got practice. Maybe we can have a few extra people at our table this year, but it's still time to make sure we're doing the right things. And that's it today. And I can't unshare for some reason.
And maybe you and Mike can answer this. Initially, they thought the variants were just more contagious, but now you're saying that they're more serious also too?
Yeah, I haven't gotten into Mike, you can jump in, definitely. But I've seen 4 studies that come out and look at it from different ways of looking at it, and they all come to the same conclusion that they're more severe outcomes related to it for the UK one. The good news is the UK one seems, and Mike, again, if you've seen updated things on this, please correct me. The UK variant seems to, our vaccines, the Pfizer, Moderna, and J&J are still well suited for it. So that's not a concern with the UK variant, which is great. But we still don't want it spreading around. And the more things spread, the more chance it has to mutate again. So we just don't want to give it that chance.
The only one on your most wanted list, or least wanted list, is the one from Brazil. And that one probably is if it gets hold, that's probably even more dangerous in terms of ease of transmission and severe disease. And I think you laid it on the spot. The longer we delay, as it were, full vaccination, regardless of which vaccine, the more targets are available for any of these. And then I have a question for you, since I looked but didn't find, and that is, although it's not in any of the protocols that led to the approval of any of the vaccines, I was wondering if you've heard of any indication that any of the vaccines, shall we say, diminished transmissibility.
So that's a really great question and a really important thing that people are studying. That was not necessarily in the protocols for the original
Right.
emergency use authorizations. It has been studied post-authorization. There's really encouraging evidence from multiple sources that it does actually reduce transmissibility or, contagiousness. And like,
yeah. What I mean by transmissibility is, in other words, the vaccine actually diminishes the capacity of the virus to basically infect the 2 or 3 or 4, depending on which virus.
Yep.
Yep.
Yeah. So there is evidence that it does reduce spread as well, and as well as protect against severe disease. And I think you can see evidence of that in Israel, and there's some other early vaccinating sites that have had success. You can see it in the long-term care centers have had some great evidence to suggest that it is protective from transmission of disease. And then the other thing that gives me confidence is the CDC director when they went through the guidelines about what vaccinated people can do. One of the reasons they say if you're a vaccinated person, you don't have to wear your mask if you're around one household of unvaccinated people. And they do that because they're confident that you're not going to spread it to the unvaccinated people. So the evidence is mounting. We're getting more every day, more confident that it really is reducing spread. So even more reason for everyone to get vaccinated, because if we're protected against severe disease and we're not going to transmit it to everyone else, the better. And then also so Pfizer is approved for 16 plus, Moderna and J&J are approved for 18 plus. So everyone who's eligible to get those vaccines is like, if you get vaccinated, you're kind of like a fire stop for it spreading. And if we think of our schools are going to be filled with people who can't be vaccinated for at least till the end of the year, if families can at least get vaccinated, then we're going to reduce the risk of our kids being in a setting where they're spreading. We're helping to create that fire block. So for the people who can't be vaccinated yet. So that's really important that we just keep.
Yeah, I would also have to say that those, I would say up to this point, still anecdotal, not completely confirmed by numbers. The reduction in transmissibility is the fact that the firms that have already produced vaccine and being used are now engaged in clinical trial for younger folks.
Yes.
And they wouldn't be diverting there if that transmission factor, that they have to make a decision. Do we want to put our money on, and the government has to decide, do we want to put our money on reducing transmission, or do we want to basically vaccinate more little kids? And I think the answer, when they gave the answer, we're going to go after little kids, that tells you they must be pretty confident that the data is more and more, we can reduce transmission with these vaccines, which would be a real big bonus. I hope it comes true.
Me too. I heard the Pfizer and Moderna trials for ages 12 to 18 have finished enrollment. So those data should be coming out sometime later this summer. So that if all goes well, hopefully we'll have vaccines for the middle school and high school ages, or the remaining high school ages, I should say, because 16 plus can get Pfizer now. Hopefully we'll have vaccine for those age groups by the end of the year, maybe beginning of next year. And then the Moderna started enrolling for the 6 months to 11-year group. So that's another big group. But that just started enrollment. So that's happening even while they're finishing up the 12 to their 12 to 18 group, which is just, it's encouraging that they're finding enough evidence in the 12 to, with vaccines, you step down, you do age groups and you lower them. So the fact that they're starting it, even though they have enough evidence to feel confident about moving down, is really helpful, encouraging.
And certainly much better immune systems with which to deal.
Yes.
All right, does anybody have any questions for Katrina at all? No, thanks. You don't think we'll ever be green?
I would love to see it. And I think in a few weeks when we have more people vaccinated, I wouldn't be surprised if we hit the green and come back to yellow. We'll put it that way. Like we might have a week or two where we dip. I am concerned given the behaviors and the openings and the holidays and the schools. I think it will be hard to dip to the green and stay there. And we'll be lucky if we can oscillate right here where we are until everyone in our town is eligible and able to access vaccines. So we can be eligible and have our appointments sometime in the summer. It's still going to be a long rollout.
It's kind of like the perfect storm. Everything opening, schools going back.
Yeah, it's all happening at once. It will be interesting. So that's why like those layers of cheese matter. Don't give up now. Please don't give up now. Just keep doing it every chance you get. Get that mask, get a better mask. Let's do what we can.
I think we should improve the, what do you call it, the little flying poster we have in Littleton's Common when it says, keep masking. I think we ought to change that and somehow make it even more dramatic.
Mask up and vaccinate.
Yeah, and vaccinate. Yeah, we need to have that updated to the latest and greatest.
Yeah.
So let's
I'll run that by Cindy, see if we can get
no more than Cindy. I think we ought to hit all of them because they seem to be afraid to take any initiative unless the wind is blowing directly in their faces. So I would suggest that we assault them with, shall we say, present them with a strong argument that if we don't do this, we're putting Littleton residents are being deprived of the latest and greatest.
We can recommend vaccinating, but there has to be vaccine too, Mike. So
I'm sorry, what?
I said,
listen, Jim has just told us, and that look, Baker wouldn't go ahead and pledge. Baker would not plunge ahead with this. He's conservative, so he wouldn't plunge ahead with this radical idea of having more vaccine unless he got some very firm promises. Also, it reverts the other way. I mean, can the federal government in its current form dare take a chance and back out?
I would hope not.
Nope.
Yeah, no.
Can I ask a question?
They promised a lot.
May I ask Jim a question?
You may.
Jim, I was curious, and you may not have this data, but I was just wondering if you have a feel for how many of our residents ages 65 and older have actually been able to access vaccine yet? Do they have, or are there plans for data on uptake by town or Neshoba's associated or whatever region?
My understanding from one of the Department of Public Health meetings is that they were putting together a report that should be able to report by zip code and by age. I don't know if that report is live yet.
Yeah, it's not public, which I just didn't know if that's something that you have a feel for. The other reason why I keep asking people to use cheese, even if they're vaccinated, because if our elder population in our own town hasn't had a chance to access vaccine and we're all mixing and doing what we want, assuming they've had access to it, we could really impact transmission and impact them. So I just wanted to get a feel for how many in our town are still at risk because they haven't had vaccine.
The state numbers I heard were north of 70% of those 75 plus, and it sounds like maybe north of 60% of those 65 plus and the comorbidities.
Okay.
So have received at least a dose.
Okay.
So,
Speaking of that,
assuming Littleton's the same, we're moving in the right.
that's, I guess I would, or apply that kind of percentage you see on the map.
Yeah. I was just curious if we would end up with a weekly report talking about vaccination coverage, but we'll see. Thank you.
Thank you.
And speaking of that, Jim, I think you sent an email about the homebound population.
So just to kind of briefly mention, the state ask local boards of health if they, they're looking to try to get the homebound vaccinated, and the state has a definition of homebound, which is pretty significant. You either need you have to be in such a condition where you need at least 2 people to move you out of your house or need a medical transport. And they provided a program which I have shared with the Council on Aging's, along with an intake form. So we Neshoba opted to do the homebound locally. The state does have a program that they'll at some point in time get a mobile van together and can do it with mobile vaccinators. But we've decided we do it locally. So we've sent out the survey to the Council on Aging's for them to kind of identify people in the community. They'll send the intake form to us. At this point, the state hasn't told us where the vaccine will come from for this program or how we will access that vaccine. So that piece of it, they're working on rolling this plan out, and they're really looking for information gathering and planning by the end of the month. One of the things that they mentioned on the calls to us, and something that's very encouraging, is they would like to have Johnson & Johnson vaccine for this program, which would make a lot of sense. A homebound visit is a pretty time-intensive visit. So if you only had to do it once, that's probably good for the homebound person, good for staffing and doing those clinics.
It's true. One shot.
Yep.
All right, thanks, Jim.
Yep.
Anybody want any more questions for Katrina or Jim? We'll move on.
You did a good job, Katrina. Very good job, honey.
All right, thank you.
Thank you, Gina. Thank you.
All right, so we're going to move on to correspondence. I got a correspondence from John that I will forward to you guys about some things that were discussed on the March 10th meeting about why the cases are going down. So I'll have Janet send that to you guys.
I thought we received that.
Did you receive that? Oh, okay.
Yeah.
All right, great. All right, thanks for your information, John. Anybody else have anything that they received, any correspondence that they want to talk about?
Oh, thank you.
No.
Okay, so we'll move on to approving the minutes.
I think
Janet, you got comments, I think, from me and Mike. Did everybody read the minutes for the 10th, 17th, and the 10th of March?
Yes. Yes.
All right. So can I get a motion to approve the meeting minutes? Do you guys have anything to add to them, or can we just go ahead and approve all of them?
right.
Everybody else?
March 10th, you're going to do as modified, and the rest, if there's no changes, will be as written.
Okay.
I'll make a motion, if I may, that the minutes of 2/17/21, 2/10/21 be accepted as presented, and the minutes of 3/10/21 be accepted with the modifications as indicated.
I second it.
Great. We'll do a roll call. Kevin Baker,
Baker, yes.
Gina Fratelloni,
Gino, yes.
Louise Nichols,
I agree, except yes, except for 217. I was not
Change.
there.
Oh, that's right.
So I abstained from the 217.
oh, because you weren't there.
Yeah.
Okay. And Mike Zeldin
Mike Selden, yes.
and Lisa Flanagan, yes. So if we can just change that, Janet.
Mm-hmm.
Great, thank you. Any member comments today?
Just have one or two just to update folks of what's going on assessing where Littleton's Board of Health is going forward. That is looking at the future. Just want to let you know that I'm still proceeding, but getting very close to the end of what I call the investigating stage, which simply means gathering information from reasonable and all possible sources that I can get it, excluding anecdotes. I include those, but they're all labeled as anecdotes, just to be clear, because there's a lot of anecdotes out there. And the basic idea is very simple, and that is that our current arrangement with with Jim and his colleagues at Neshoba has been operating very well. I'm going to leave the discussion of the pandemic out because that's unusual. And number two, requires it requires a little, shall we say, you have to look backward, give it a little time for things to evolve in our thinking. I'm leaving that one out because it is unusual. Everything got distorted as a result. A lot of that doesn't, on the other hand, is very clear, I think, to everyone on this board that Jim and his colleagues not only performed well, but I say well beyond the call of duty from the very beginning when that crisis hit on the otherwise unregulated elder housing or elder resources that really put everybody into a bind. And Jim and his colleagues reacted very well, along with all the, shall we say, first responders here in town to deal with it. So that needs to have a special, as it were, separate look as a very special and important chapter in public health here in Littleton. Leaving that one, shall we say, unfortunately for the moment, the real question is, are we now, and if we're not, when do we get to the point, if ever, where the changes in town would necessitate a change in the way we approach public health and how we implement the policies required by the state? It's a sort of a simple way of stating it. We're certainly not a city yet, and however you define it. And there are many towns around us who are, not growing quite the way we are. Of course, a lot of the towns around us aren't located where we are, nor have our history. So I'm not trying to go into what we'll call projecting where we're going to be, but we certainly are in a very different place than we were, let's say, 5, 6, even 10 years ago, with respect to issues corresponding to public health. All you have to do is take a look at the number of restaurants that we have here in town. And then most of them, of course, that we can identify are at the point, but nonetheless, they're in our town, and there's a certain responsibility that goes along with that. And the other component which I want to raise is that the number of houses that have been built, and in other words, everything having to do with what I would call building permits, and they can be small ones, including, I don't mean to mean anybody's swimming pool, but I want to put a swimming pool in our backyard, and I need Jim's help. I mean, this is what it boils. And it goes all the way up to 24 and 27 and 34 units of new housing, single family homes, where shall we say, the terrain and requirements to get the permits really differ almost, next door to each other, requiring a professional assessment of each and every one of them. So it's a question of how much more development, how will the development proceed for new construction, modified renovation. Those are the big ones. Those are the ones that occupy the greatest amount of time, whether or not it's an individual or just wanting to fix his or her house, or it's a developer doing 40 or 50 units, whatever. So I'm almost finished with, I say, a draft, which I will make sure that our chair and others get a chance to look at, and then we'll take it up with once it gets okayed, we'll send it on to the select board. And then we'll basically begin, I hope, having our own public hearings, getting input to either modify the findings, I'm sure they should be and could be, and then try to make a decision or lay out a plan of action jointly with people involved, including Jim, of the best way forward. Lisa, you're muted, so if you're telling me to shut up, I can't hear you.
No. Thank you, Mike. Thank you for all your effort and all your investigating and your research. I appreciate it.
Well, I also want to thank Jim, who is a true professional, who has it's really interesting to find out how small a town we once were. Really interesting.
All right. Anybody else have any comments?
Going to be a big project coming up on Foster Street near the railroad.
Yep. I think planning board is meeting on that, or they already did last week.
They already did it, yeah.
What's so without being cryptic, what's the big project on Foster Street?
You'll see. I haven't got the letter with me right now, but as soon as I find it, I'll just let you know.
I mean, it's a 40R. Is that what you're talking about?
It's going to be a big project, just to let you know. It's a small town. It's a small town. You better build your swimming pool and learn how to swim, okay? Because otherwise you're going to get upset and you're going to drown. This is going to be a small town. It's going to get big town. Remember that. It's a lot of land to be developed.
All right.
For the new coming, like you, Mikey, my dear friend.
Well, it's time to get rid of all the old men like Gino, don't you think so?
I'm only 34, Mikey. I'm only 34. I still have a lot of energy, my man. Nevertheless, I still love you.
All right, gentlemen. Any other member comments? And if there's no member comments, what about public comments? Janet, anybody with their hands raised?
Yes, Lisa, John Kay has his hand raised.
Okay, John, if you state your name and your address and go ahead.
Yeah, it's John Kurzwick, 171 Hartwell. I kind of missed the first part of the meeting about the pool testing, which is what I kind of called in for. But I think I heard that the board wasn't mandating the testing. I think I heard that they are recommending that the testing take place.
John, we rescinded our motion requiring pool testing. We had a discussion and we're waiting to hear from what school committee is going to, they're having a discussion about it tomorrow.
Okay. That I just wanted to follow up with that. Okay. I missed that part, but thanks for notifying me of that. Yeah, I mean, just related to that, I think you guys were talking about, new signage or, for the town. And, my position would be is, I would focus on, a sign that says, sick, ? Stay home. In my opinion, that is the number one public health thing that we can be doing, because all the data we keep getting shows that, there's very few, or at least it's a fraction of the actual symptomatic people. And the asymptomatic people are less likely to spread. At least that's what the data is showing that for in-household spread. Secondary attack rates for symptomatic people are much, much higher for symptomatic people. So, as it relates to the school, that's what we should be laser focused on, keeping sick people out of the school. And just as an anecdote, I was at the dentist office, and that has to be the highest risk occupation short of somebody, working on a COVID patient. And so I asked them, how are things going? And they said, nobody's been sick in the office. But what she did say is, and this is what I think all dentist practices are doing, is they do a pre-screen. Nobody's allowed in that office if they're sick or any symptoms prior to coming in. And to me, I think that's very, very, very effective way of controlling things. If we spend a lot of resources going after asymptomatic people, I think it makes it harder for the public health agents to really track down and go after the people that really are spreading this, which is the sick people that are sneezing, coughing, and just putting it all over the place. So, to me, if I was going to put a sign up in town, it would say, if you're sick, stay the heck home. That's what it should say. So anyways, that's just my 2 cents. Thank you.
Great. Thanks, John. Actually, that was something that we discussed, Cindy and I discussed about the solar signs, the blinky signs. And we're talking about having a rotating message, sick, stay home, wear a mask. I could probably talk to her about doing the vaccine, get vaccinated, stay home, just continue to remind people about those layers of cheese. So I'll do that. So, all right. And nobody else, Janet? We're good? Anybody else have anything that they want to discuss? All right. Anybody want to make a motion to adjourn?
Make a motion to adjourn. You have a good weekend.
Oh, and happy St. Patrick's Day, everybody.
Yeah, that's right. Don't get drunk, will you?
Actually, before we adjourn, we'll make a note. We're going to have a meeting on the 24th. And
Okay.
I think we'll get school committee. Way to go, Mike. That green that I just saw?
He's-
Put it on.
He
Put it
doesn't,
on.
he doesn't have,
Got a
he
green,
doesn't have any,
got a green tie.
You gotta model it.
he's gonna drink the blue beer, not the green one. Michael, I love you, baby.
So I'm hoping
24 meetings.
that school committee will be able to join us next Wednesday for more discussion on the pool testing for extracurricular activities and sports. All right, so
Would you say the 24th, Annie? The meeting, 24th?
Yep.
Thank you, thank you.
Hey, Gino,
What?
it's the 21st century. Stop calling our chairman and other women of any age honey. Call
I'm
your wife
sorry.
honey and limit it.
I
Thank you, Mike.
apologize, Mike. Dear chairman, would you please forgive me if I call you whatever? I've been reprimanded, okay?
thank you.
You're welcome.
Thank you, Mike.
Mike,
right.
go drink the beer, will you? You feel better.
We have a roll call for,
Oh.
Second.
it was seconded. I forget who was.
No,
I'll second Gino's motion to adjourn.
Thanks, Kevin. So Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Yes.
Louise Nichols,
Louise Nichols, yes.
Dr. Mike Zeldin.
Who? Mike
If I'm
Zeldin,
not
yes.
honey, if I'm not honey, then you are doctor.
Hey.
Oh, yeah. False equivalence. Yes, I agree that
All right.
we need
All
to
right.
adjourn. Yes,
Meeting's
please.
done. All right. Happy St. Patrick's Day, everybody.
Good night.
See you next